welcome. Welcome everybody to our Both Sides of the Conversation. This is our Sunday chat. Thank you for joining us. We meet here at this virtual space every Sunday at 2 p.m. Pacific time. I am your guest co-host Danielle Tompkins and your co-founders of Both Sides of the Conversation. And my co-hosts for today are
Rico Hamilton.
John Henry, co-founder of Both Sides of the Conversation.
Thank you, everyone. So Both Sides of the Conversation is providing a safe and honest space for open conversation. Please be respectful of that. Be respectful of the panelists, hosts, and participants. Healthy debates and conversation are encouraged. Don't personalize anything with anyone. Name calling, bullying, or trolling will not be allowed here. Your perspective is yours. It's not a prescription. Please be advised that you don't have to agree, but please show respect, and creating an open dialogue for healing and education is what we do here. For those of us that are joining us live on Facebook, please be sure to share this video and even start a watch party so that we have as many folks included in the conversation as possible. Before we get into our segment today, let's go over some interaction guidelines. But please, for our panelists, be sure to have your mics muted when you're not speaking. For our audience that are joining us on Zoom, you can utilize the raise hand feature or chat and let us know what you think. And if you'd like to ask any questions for our panelists today. Also, if you're joining us live on Facebook and watching in the comment sections, ask your questions. And thank you. Enjoy the show.
Go ahead, Reek.
Yeah, so we got an amazing show today. Welcome everybody. Welcome our amazing guests for today. We have an amazing conversation around Black health initiatives, what's going on in the Black community. And we know that our communities are struggling when it comes to health. We have the biggest disparities as it relates to health. So we want to be sure that we can have an in-depth conversation as it relates to health. So Danielle, can you invite our guests in and do a good introduction for them?
Absolutely. We have three wonderful panelists joining us today. Our first panelist is Dr. Danielle Williams. Dr. Danielle Williams is a family medicine primary care physician at Ross Community Health Center in East Oakland, California. She attended Howard University for her undergraduate in education and then went on to medical school at UC San Francisco. She completed her residency at Harbor UCLA in Los Angeles County. It is there where she developed her passion for street medicine and currently leads the street team outreach program at Stomp at Roots. Please welcome Dr. Danielle Williams to the show.
Hello, everyone.
Our next panelist joining us today is Nisha George. Nisha is a labor and delivery registered nurse for over 11 and a half years. She has firsthand experience in how COVID has affected the health in our pregnant women population and our teens and children. Please welcome Nisha George to the show.
Hello, thank you for having me.
Our last panelist is Teresa Tatum. She is a graduate of Samuel Merritt University and holds a Bachelor in Science in Nursing. And she's also a CCRN, and she works at Kaiser in Oakland. She's a pediatrician, and she's been there for close to 14 years. She's currently a doula in training and mother of 3 and grandmother of 2.5. Please welcome Teresa Tatum.
Hello, everyone. I'm honored to be here, honored to be asked to be here.
All right. Thank you for our lineup. We have some powerful healthcare professionals. The purpose of this conversation is to engage the community to talk about the issues that is affecting us, not only during this pandemic, but also in our day-to-day lives, because we know our Black and brown health is something that's being impacted even more with this pandemic. So I think this conversation is important for community. Please, community, as you guys come in, if you have any questions for our healthcare professionals, please use our question and answers. Please use our chat for the people that's in the group. If you have any questions or things that you would like to throw into the topic, we'll be watching our group and our page. And if there's any other professionals or healthcare professionals coming in at a later time, please raise your hand so that we can pull you up to join in on the conversation. So with that being said, I'm gonna open it up to the floor to our professionals to talk about our health issues and some of the things that they may have see on the back end as a professional provider or a caregiver in our community. So if you guys want to kick this off, we can start with, let's get into the vaccination. I think that's a hot topic right now. And I know that our people have a lot of issues with this vaccination. The first round is coming out. And I know a lot of our medical facilities are getting more vaccinations coming in, and it's still a challenge for our people to agree that this is what we need to do. And we would like to hear some from our health professionals and get you guys expertise on what you guys are feeling or what you're seeing or some of the information that you're getting back, feedback from this vaccination. So whoever would like to start off, we can go ahead and open it up to you.
I can start off. So I am currently fully vaccinated. I got both my vaccinations, Moderna. I just completed my second vaccination last Monday. It took a lot of researching, soul searching, prayer, and everything to make the decision. I work in a pediatric ICU, and I have to be honest with you guys, the first time they offered, I did not. And seven other people of color did not. And there were only 7 of us didn't do it the first round. I just didn't have enough information for myself. And so I did some research on what the vaccine entailed and found out that it was an mRNA, which is a part of protein that's on the virus. To be honest, I did it for the same reason that I get a flu vaccine every year. I live with seniors. I have a 79 and 85-year-old in my home, and grandchildren running amok. And at some point I had to decide that although I didn't feel like I was, so susceptible to be taken down by the flu, I decided that if I brought it home, I might take down someone. So it was kind of an unselfish act that I started taking the flu vaccine, and the same reason was why I took the vaccine for COVID. Also, I was really tired of being afraid of COVID. It was paralyzing some days to think about going to work and seeing and hearing, everything that's going on that we've all been hearing, and to think about bringing COVID home to my family was very, very, it was a very hard decision for me to make, but I felt like it was best. And I understand everyone's opinion on this. I understand the trepidation. I understand that science and vaccines have not been friendly to the African American community in our history, and that's just a fact. We can act like it, that it didn't exist, but it absolutely does exist, the fear. The one thing I did have to tell myself is that everybody's getting the vaccine, all colors, all nationalities. And I can tell you guys, although I work in the pediatric unit, they have been sending us to the adult floors to be helpers, to help with the adult population. It is gut wrenching to go through the adult ICU floor. Who I saw was mainly my Latino Americans, bed after bed after bed, intubated. The adult actually took over our pediatric ICU, and we are now moved down to another area of the hospital, which is basically recovery, that we're taking care of pediatric ICU patients because they ran out of beds, and you need to have spaces that are private so that you're not aerosolizing the COVID. And our pediatric ICU has all private rooms. Actually, the whole hospital has all private rooms, but where we moved to was there's just curtains. So you can't have any infectious disease flying around with that. So, but walking through and going down there is something that unfortunately we cannot show the public. You cannot show the people that are on the ventilators for so many days. We've never ever seen anything like this in our life. And so I got vaccinated. I had symptoms. Yes, I did. The first time I took it, I had a slight dull, like kind of like naggy kind of headache. And I had this weird little queasiness in my stomach that I didn't associate with the vaccine until a few days later. Other than that, I was okay. The second time, I got the same little weird, dull headache. Not the queasiness, but kind of like fatigue. And if you do your research about the vaccine, your body is supposed to mount a response to you getting that that vaccine. It's supposed to say, "Oh, we see this, let's attack." And so the fatigue that I felt, I expected. There were some of my coworkers, and not there were of other nationalities who had severe like symptoms, nausea, vomiting, aches, pains, things like that. And I um, I did not experience those symptoms. Now, I would like to attribute it to my African American heritage, and I'm a strong Black woman, and I don't know, maybe my system is, a little bit more robust. I don't really know what to attribute it to, but I did have some, achiness, and then it was gone, and I'm done. I don't have any regrets, and that's it. So.
Okay, we'll move down along, and we also want to say thank you to all our healthcare professionals that's on the ground in the hospitals working long hours. We definitely need to keep them in our prayers because it is a tremendous job that they have to do with the stressors. I'm in a hospital environment myself, so I see the hard work. So we would definitely want to salute you guys and give you your kudos for the extra mile that you guys go, because I know it's long hours, a lot of double shifts, and a lot of things going on, and at times it can be chaotic and crazy. So we want to definitely thank you guys for your work. But we'll move down the line. Dr. Danielle, do you want to speak to any of the vaccination stuff? Have you been vaccinated or not, or something that you want to contribute to the vaccination conversation?
Sure. So I'm different in a way that I'm not actually working in a hospital. I work at a primary care clinic. So I'm dealing with the community. My clinic is in East Oakland. So we have 2 sites, one on 98th and International, one on 72nd in MacArthur. So I kind of go back and forth between the two. Plus I do street medicine, which means I go directly to the homeless encampments and deliver primary care, urgent care. So I think if it wasn't for the street medicine piece, it wouldn't have been maybe as stressful for me, given I'm in a primary care setting. But because of that street medicine piece, I've had to been called to action in a lot of different ways that I wasn't before. So I lead an entire team, and before COVID, we would go around to different encampments, certain days of the week, and we would just kind of rotate around back to those sites every 4 weeks. Given COVID, we had to change everything. We had to just start doing outreach at first. Then we needed to, then we started doing testing, rapid testing. So we're doing testing in the encampments. And then when a positive comes back from that, then we have a whole other chain of reaction that happens of getting this person isolated, hotels sprung up. I was able to house people into hotels for the first time. So a lot of things happen. So because that's my main experience with COVID during this time at work is mostly patient phone calls, because I do telehealth. So my patient's personal experiences of having contracted it, plus the people that I personally tested in the encampments. So getting to the vaccine, I was offered it at the end of December because of the work that I do. I took Moderna as well. I already received my first dose, and I'm supposed to get my second dose tomorrow, actually. I also did not have any serious reactions, but also I never have to vaccines. So I think that the vaccine conversation is a lot deeper. It really just depends on how you feel about them in general. I was hesitant about this one. I wasn't hesitant about other vaccines because I've been getting vaccines my whole life. And I've never had any health issues. I mean, I think I fared well in life with vaccines. But this vaccine was new. It was a new type of vaccine. So that's what had me hesitant at first. So given work was really busy, honestly, I didn't have time at first to really read about this vaccine. And the way that I get my information is directly from the source. So I get my information from medical journals. So I wanted to read the research paper that the FDA approved for the vaccine. I wanted to go through the nitty-gritty details of all the participants, what this it's kind of like being back in medical school again and having to learn something. So I had to refresh my memory on even how to read a research paper of this caliber. So that's what I did for this. And my clinic, the other physicians and nurse practitioners that work at my clinic were also all hesitant. And my boss, my CEO, Dr. Noha, put together a session where we could talk to an infectious disease specialist, and we all providers asked all of our questions to this infectious disease specialist. And that, coupled with me reading the research papers and reading the background research papers they use in that paper, I understood that this vaccine isn't as new as I thought. I just had not heard of mRNA vaccines before, but they actually have been around for at least 10 years. And they've used them in other settings for the flu. They were preparing to use them for Ebola. They just never used them in this magnitude before, but they actually are made to use for pandemics because of how quickly they can be made, because it's basically just a blueprint. And then they just basically change the code depending on whatever virus or bacteria is causing the cases of the pandemic. So we can get more into it. I'm sure we will. But basically, I needed to do my own research for myself about it. I need to understand what this vaccine could do and what it can't do, and understand the science of it instead of really getting into conspiracy things about what vaccines do.
Man, powerful, powerful. Definitely, as we get into conversation, you are going to be a keynote when it comes to our health disadvantage for people that are homeless. And we know here in the Bay Area, with the gentrification and the cost of living are hitting our communities in ways that they've never been hit. And this healthcare piece is definitely going to tie into it. And yeah, we're going to continue that as we get going here. I want to move down to Naisha. Is there anything you want to put in about the vaccination or your experience with that?
Just to kind of piggyback off of the two young ladies that had spoke ahead of me, I was pretty hesitant to getting the vaccine. I actually was not going to get it at all. But I've had my own scare with COVID, thinking that I may have had it. I did test negative for it. My uncle, somebody in my family actually had gotten COVID from, he's a hospital employee. He had gotten COVID and he was in ICU needing high flow oxygen and, very, very close to being intubated. What really kind of changed my decision is, in the population that I work in, I work with mostly pregnant moms who are mostly healthy. Most of our moms are healthy moms. And when that second wave came through, or is still coming through, I have taken care of so many COVID positive moms in labor. And some of these moms have been very, very, very sick. And just watching the disease firsthand and how it quickly deteriorates people was a scare for me. And then when we had got an email saying that there was a national or a global wide oxygen shortage. I was just like, oh my gosh, if I were to get COVID, like, will there be, you know, enough oxygen if I needed, you know, high flow oxygen, you know, or if I needed to be intubated? Also in Southern California, you know, how they were pretty much turning people away if you had no chance of survival. And so those are one of the things that kind of weighed in on my decision to get vaccinated. Not only that, I have a 15-year-old son who has severe asthma. And so although he rarely goes outside, you know, since this pandemic, you know, me working with COVID positive patients, the potential of me bringing it home to him and him getting severely ill, that would be that would just hurt so much if it came from me. So that was kind of a important for me to make that decision. I did the first Moderna vaccine, and I will be second one on Wednesday. Some effects that I have experienced with it is severe. Like my arm hurt a lot. One my arm hurt so bad, just the muscle weakness, and that's just any vaccine. Flu vaccines do that. That 24, 48 hours, that malaise kind of feeling. I was really, really tired. And so I slept quite a bit. I'm also a night shift worker too. So I had worked during the time that I had got the vaccine. So it just made me even more tired. I did have a slight headache, which was resolved with Tylenol. Another also reason why I also got the vaccine is my coworkers were coming down with COVID. We've had a significant staffing issue because of our staff, you know, coming down with COVID. And when you come down with that, you know, you have to be isolated for 10 to 14 days. It was coming kind of going through our staff. Also, as Teresa said it before, when our unit is slow, we get floated upstairs to med surg and ICU. So we are expected to help those nurses out who are swamped, and they are swamped with taking care of COVID patients up there. So we are requested and required to go up there and help take care of those patients as well when our unit is low. So we're kind of being doubly exposed. So just the high exposure rate for me was the reason why I decided to do it.
So, quick question. I've seen some people in the chat. So, because right now there seems to be a lot of people who are, you know, in their pregnancy right now, and there's a lot of people having children. How has the COVID affected the actual babies while they're inside of the parents? Is it any effect on them, or after delivery? Are we seeing any kind of uh, impact from COVID after the baby is out, or is it everything just to the mother?
So right now there is some research that is being done as far as how does COVID affect the baby. We do send, with those COVID positive moms, we do send those placentas out to a certain pathologist in the Oakland Bay Area who is doing some research on the placentas to see if that uh, disease kind of crosses over into the placenta and attacks the baby. The protocol that we have in place in the hospital is if a mom is COVID positive, it is recommended that she is separated from her baby. We do testing on the baby 24 hours and 48 hours after birth. Some of the babies have came back positive for it, and so they are to also be isolated. We've had moms that made the decision to. I mean, it's not a requirement to be separated from your baby, but it is highly recommended. If not, you know, some moms want to breastfeed, so they will wear a mask and try their best to try to keep their baby unexposed. If the mother does decide to keep her baby in the room, then they are 6 feet apart from each other when they are not breastfeeding. So it does kind of interfere with bonding. The father of the baby that is with the mom, he is restrained in the hospital, so he doesn't have in and out privileges. So once he is in the hospital, he is in the hospital. He cannot leave. at all because we can't have people who are COVID positive in and out of the hospital. So he is remanded into there. And if he leaves, he cannot come back into the hospital. So that's another issue that our pregnant population is having. We've had some mothers leave their babies at the hospital and until they are totally quarantined for 10 to 14 days just to protect their babies, especially if they are symptomatic. So it's really hard for these moms to make that decision to, protect their babies from this disease and to isolate themselves from their babies, separate themselves from their babies.
Wow, wow, that's deep. I mean, I didn't even think of it on that level, especially in a Black community, how close we are with our babies and have to leave your child in the hospital with you not attending it. That's deep. Wow, I didn't even think of that. Rico, you want to jump in there, ask a quick question? And I know Kosh has a couple of questions in the chat that's coming in, but go ahead, Rico.
Yeah, I just have a question on how do we educate the community? Um, I think that there's a lot of information as it relates to the beginning stages of COVID, the 6 feet distancing, and like how not to contract. But when it relates to the actual vaccination, I haven't really seen too much education on it in terms of one sheeters or things that we're passing out to give people the best decision in terms of either taking it or not. So I want to know how can we educate the community on being able to make the best decision? Because I just personally haven't seen the information, like what's in it and all this different stuff. I mean, I haven't seen it actually documented. So maybe it don't matter who answers it, but like how do we educate the community so that they can make the best decision for themselves possible?
Well, the vaccine companies have handouts, so like they're usually on the site. So like I said before, I'd always go directly to the source. So Moderna will have patient information sheets. Pfizer will have it. Johnson Johnson the next, and so forth. CDC always has information. I don't know if how people feel about the CDC, if they trust that information, but I do. It's all there. It have like a special page just for the vaccine. The public health departments, they also create information and they put that out as well. So I like to go to the actual departments of health and federal bureaus and the official entities. But also health providers or anyone, we can create information as well. And if there are organizations that spread information, nonprofits, etc., can also spread information. My clinic, we make our own handouts, our own documents. We also have like a YouTube page where we have these health briefings. They're not all about the vaccine, but they're all about different topics for COVID. So I think usually for me, my patients ask me directly, so I have like one-on-one conversations. But like educating the community will be what we're doing today, things like this, and then organizations that already spread information and know how to do that, and but having them have the most how do I say, scientifically derived information.
And that's good. That's a good question to ask because I was going to ask the same thing. I mean, being in the health field, I get a lot of access to information, but I wanted to see in your practice, are you guys seeing pamphlets? Because usually for everything in our community, there's pamphlets. And, because our community is hit by this COVID, especially in San Francisco, especially around the Bay Area, there's a lot of our people that have been impacted by technology. So people don't have access to Wi-Fi and things of that nature. And that is a good point of how we get information. Yes, this is a way, but I was just trying to see, did you guys see anything from Moderna or these other companies that's getting pamphlets out to the community? Because I'm not seeing it either. I mean, I have access to health information, working in a healthcare facility, but for the mass public, we're not seeing the big campaigns, and I think Rico brings up a good point because we've had a lot of not only just from Dr. Fauci, but different people talking about why the Black community is not engaged. But again, I don't see the billboards. I don't see it at the bus stops. I don't see the massive information hub to try to bring the Black and brown community together for this. But I hear everybody say, oh, they don't want to take it. We got to break the stigma. But again, if we don't have the information in the community, it's not at the bus stops, our nonprofits, our hubs are not talking about it and making the information in a point where our people understand it is definitely going to impact us. So thank you for saying that.
Yeah, John, I think that was like the main question for me asking it is we know the disparity as it relates to healthcare. Like there's a huge disparity when it comes to people of color and having access to healthcare, or even if they do have healthcare, the stigma and the fear around hospitals and things like that. How do we get our local nonprofit agencies, our local people who are giving out information, how do we get them the most accurate information, condense the information, and then simplify it, right? Because most likely when you look at the shot or the ingredients, 9 times out of 10, us as, community members, we ain't gonna know what none of that stuff mean, right? So like how do we get the accurate information? So then that way we know what these different terms mean, right? So the community is aware, it's a one-sheeter, this is what this means, this is what this means, so that we can get the access that, other communities have. So I think that that's the reason why I'm asking, because I wanna know, how do I give the community access so then that way they're 100% aware and know what they want.
I just want to comment real quick. It's so new, and there's always a delay with creating. Someone has to create these things, right? Someone has to sit down and come up with all the information, put it together, make it look cute and nice, and put it out there, right? So I think that just hasn't happened yet because they've been focusing on healthcare providers versus the whole entire general population just yet. So I think honestly that job is primarily the public health departments. That is who is supposed to put out information. But because they don't always do it very expediently because of usually budget reasons or other reasons that I'm not privy to, I think other organizations, like just different nonprofits, like that's their mission in some ways, and those entities should step up. Like I said, my clinic, we put out information, so that's how we're doing our part. So I think if you want to just go directly to sources that usually put out health information, and see if they have created something now.
Yeah, Ms. Teresa, you want to chime in on it?
I agree with what she's saying. I also feel like we have to take responsibility to go after. You can't sit back and expect everyone to do all the work. The same way that I can research, you don't want to think about Google or YouTube, but sometimes there are people who produce a YouTube, and it's in plain language. It is understandable. They may have questions, they may have answers for the questions. We all have the same questions. We're all slightly fearful. We're all understanding that this is brand new and nothing that any of us have seen in our lifetime. And, neither have the researchers, nobody, we haven't seen it. So you also have to take some responsibility to get after the information that you're trying that you want to know. And if you are willing and you say, okay, tell me about the vaccine. What is mRNA? I had to look it up myself, and that's just the reality of it. And it's like, okay, this, and then they break it down. But if you want something simple and you approach anyone or that is in the healthcare field, then it can be a discussion. There are some people that are just anti-vaxxers. They're anti-vaxxers for children's vaccines. So you're never going to change their opinion, and you shouldn't. You shouldn't. Everybody's entitled to their own decisions, and it's all respected as far as I'm concerned. Everybody's responsible for their decisions in their life. So we do also, as a people, have to seek out the information. It's there. The information is there. If I can look it up and try to do just a little bit of research, someone else could look it up. And if you want a pamphlet, ask one of us. Ask someone. Ask someone in the healthcare field. Can you get a hold of a pamphlet? If it takes me, like she's saying, going to Moderna's website or going to the CDC website, I'm sure there's some one sheet thing to say, this is the vaccine, this is how it's made. Now, when we start talking about proteins and DNA versus RNA and all that stuff, it's too much, right? It may even be too much for some healthcare workers. We're just like, okay, what is this? Is this a dead vaccine? Is this a live vaccine? Like, you can just branch off into and have the information become overwhelming. So you, there, as much of the information is there as it is that you can satisfy your questions and to make an educated decision for yourself and your family. And yes, as things like Dr. Danielle said, as things progress and we learn more, things will come out, pamphlets will come out, because I don't see this going away anytime soon, unfortunately. And then but this is new. It's all new. It's all new to everybody. So,
So I
yeah.
want to jump in there because this is both sides of the conversation, and I get it that community has to do their part, but with the issues that our community face, because we're talking about the Black and brown community, and typically we talking about the people financially at the bottom that's struggling, or some that's the working class that's just struggling to keep up with the access. And I think what I'm hearing from community is we're letting a lot of our elected officials get away with the excuse of this is the first time that this is happening. Now, granted, this is the first time we've ever had a pandemic like this, right? But we have had the Spanish flu. We've had things in history because we know we live in a country where everybody want to talk about historic events. So we've had these historic events before, but I also don't want to get off the hook of accountability, because we do have, like Danielle said, public health. We have emergency preparedness, and our elected officials and people that hold these titles have did a disservice to community when it comes down to these emergencies. Just like we have to prepare for earthquakes, tornadoes, storms, and everything. These type of conversations have to happen, because I think we let these people off the hook when we say, hey, we have to do our own. They have a responsibility as leaders of community, as elected officials, to make sure that they do their due diligence. And this is why community is so upset. They knock on our door when it's time for election. They want our votes. It's pamphlets all up and down our streets. But we have an emergency like this, no one shows up. No elected officials, no people from those departments are showing up, and we got to hold those people accountable. And we're going to continue here to hold these people accountable, because we're looking forward to getting our San Francisco public health officials on, our city attorney, because these are the conversations we have to have, because we want community to feel, if we want this Black connection with our healthcare professionals and our city public health people, our community wants to feel like we are important and they care about us. And when we don't have this type of literature coming to the community, and we don't have these people engaged in making sure that they do whatever it takes to get it to the community, this is where the disconnect come in. This is where the trust issue starts. And this is what make the Black and brown community step back and say, here we go again, another incident. So we're going to continue to hone in on that. I think that's important. You want to say something, Rico?
Yeah, no. I think that's the biggest concern, and that's the reason why I'm asking is, the community is very, very intelligent. Our folks is very, very bright, and we are some of the brightest stars that's out there, period, right? So the rollout, right? So when COVID-19 hit, there was a rollout that happened here in San Francisco that I seen. We're all handing out all these flyers saying 6 feet distance, wear a mask, wash your hands, and the promotion and the funding that was put behind that is not the same as with the vaccine, right? So in talking to the community and, with the work me and John do in both sides of the conversation, that's the biggest fear, is why the investment isn't there for people to know, right? So now it do make people feel like this is an experiment, like in their heads. I don't know. I did have a couple info sessions with some folks about what's in the vaccine and all that. So I'm kind of aware, but this is what community is saying to us. And we don't know what to say, but what Miss Teresa is saying, you got to get educated. You got to get the information. You got to go and seek it if this is what you really, really want. But the community just don't understand why the rollout for wash your hands and wear a mask, why so much money was spent on that end and not on the end to actually protect folks, right? So that's where I'm kind of struggling with and trying to figure out, like, I know it got to be some funding somewhere to make this happen. Because like they definitely promoting it to our community, but for some reason the information just isn't there to where I can visibly see and make a conscious decision unless I go out and seek it on my own. And we know in our communities, a lot of folks just aren't going to do that.
Also, the initial rollout for the washing your hands and the mask, that's all we knew how to do in the very beginning. And a lot of people still weren't doing it. A lot of people still are not doing it. So let's start there. We put, okay, so we're saying we put a bunch of money out to talk about the mask and washing your hands and staying 6 feet and not having a gathering of 50 people in your house because we have this thing that we don't know enough about, and we still didn't do that. Now we're at the point where we're past that. Look, we told you to wear the mask if you're out in public. We told you not to stand close to each other. We told you not to gather in your house, and you still decided that, no, we're gonna do this party because it's, you know, man's 6th birthday, and it just has to happen because God forbid we don't have a party. Okay, so we as a people are hard-headed. I'm sorry. The Latino community, my neighbors have had parties. They have not stopped having parties. Mariachi full parties, clearly. My family members, I have 2 out of my 3 children have been positive with COVID and gotten through it by the grace of God. And so, you know, we have to take some responsibility for ourselves, right? I have hosted Thanksgiving since I was 21 years old, and I'm 50 something. I did not have Thanksgiving this year. And when my family, I believe they understood how serious I was when I said, we're having porch pickup. I'm going to cook everything that I normally cook, and everybody's going to get individual aluminum pans full of your portion for your house, and you're going to pick this up on my porch. It just wasn't worth it to me, right? So they know how that is my absolute favorite holiday is Thanksgiving, because all you have to do is make the food taste good, and you get together and be merry and eat. It just wasn't worth it. So yeah, we had the campaign for the masks and the 6 feet and the hand sanitizer and the washing and the not gathering. And some people still didn't even do that. So
That's definitely true. And we got to do better community as well. And we've been pushing that here, making sure that people stay safe and social distance and do all the right things. I see Danielle have her hand up. Danielle, you wanted to ask a question?
Yes, so thank you. I had a burning question about this vaccine and immunity and things like that. I was able to ask it to some medical professionals, but I didn't have all of my answers that I wanted. So the question that I asked originally is, if somebody tests positive for COVID, why is it that they need the vaccine? Their bodies have already built the antibodies. And so what the doctors told me is there was a study done for people that have tested positive for the virus, and it was shown that the antibodies only lasted for 3 months. So if you take the vaccine, and the purpose of the vaccine is so that you can build immunity and build those antibodies, does that only last 3 months too? Because people are having second dosages and third. Like how many times do we have to get vaccinated in order for us not to get COVID? And is the vaccine more effective than what your body can do naturally? So my question, I guess, is what's in this vaccine? What's it going to do to your body that your body cannot do naturally if you are infected with the virus and you survive?
I can answer that. So to answer your question, when you catch COVID, you do make some antibodies. However, you might, some people have mild symptoms, some people have more severe symptoms. So you're going to develop a different amount of antibodies depending on how severe that infection was. When you get the vaccine, you're going to mount a robust response to the antibodies that they've studied. And they've shown that when you give this dose, it, for this, like at least for the ones I read about with Moderna, it protects 95% of the cases. And they tested this for over 40,000 people. So they know that when they give the vaccine, you will have a more robust response than if you just caught COVID alone. Now, to answer your question about how long it lasts, the jury's still out on that. So the study only goes for 2 months because of the fact that they needed to get the vaccine approved so that we could start using it and start slowing the cases. Because as we already mentioned, masks and hand sanitizer and distancing obviously didn't work. So I wasn't even a proponent on vaccines in the beginning. I thought we could do it with masks. And I was like, oh, that's it. That's all we gotta do is wash our hands and stay apart. That's easy. We got this. Almost a year later, we're still here. So I don't feel like we're gonna get ourselves out of this, especially given the leadership of our country before and how that led us to this point. The vaccine, we don't know yet. They're still studying the people from that trial and then everyone receiving the vaccine now, I'm sure. So it's kind of hard to tell. So that was another hesitancy about it all, because all the information is not there like we've had for other vaccines. There's some things we just don't know. But we do know that you do get a more robust response with the vaccine versus just catching it alone.
Okay, and then, the other thing is there were some people that, in media anyway, that have tested positive for the virus after receiving the vaccine. Have you heard anything about this?
I've heard about like maybe after the first dose, you're not fully at the 95% interval yet. So I'm not sure if those people happen between the first and second, because that would make a lot of sense. So after it's a 5% chance that you would likely catch it. But even in those 5% that caught it, they only had mild symptoms. So even if they did catch it, no one ever had to go to the ICU. There were no severe symptoms. It made at least the infection mild.
Naisha, you had a question. I see you had your mic off.
Yeah, there's like Dr. Danielle just said, they're still studying it. Just like the flu vaccine, we have to get that yearly. There's different strengths, there's different variances. We don't get the flu vaccine once every 5 years, once every 10 years, it's yearly. So it is a strong possibility that we might have to get this yearly or every 3 to 5 years, just depending on, the variants of the different strains and how our body responds to it and how long we can keep these immunities. So that's also a possibility.
Yeah, I think that's deep. I know Kasha had a couple questions in the chat. Kasha, did you want to go, or can you send them to me and see what we had? A couple of questions. I think one of them was one of the chat questions was they would like to hear the panel thoughts on wearing 2 masks. What are you guys' thoughts on people wearing 2 masks?
For me, it depends on what mask you're wearing. At the beginning stages, we were wearing in the hospital, we were wearing our N95s. And because we had such a big shortage on N95s, we wanted to keep our N95s clean. So we would wear like another mask, like a regular surgical mask or procedure mask over our N95s. And then after research, they discovered that wearing an N95 and an additional mask, it kind of hindered the N95 and it didn't allow it to work properly or as designed. So we stopped wearing the mask to keep the N95 clean because it didn't allow the N95 to work properly. So it also just depends on what type of mask that you're wearing. You want to wear a mask that has like a 3M filter in there. So some of these masks are nice and cute and all that stuff, but they don't really have a filter in there. And yes, wearing a mask, any type of mask is very helpful, but you want to get the best out of that mask. So you do want to wear some type of a filter. I think that is appropriate protection for you. But if you're wearing just a basic mask without that filter, you want to question how much protection are you really getting from that mask.
Yeah, we just also want to make it clear. I know N95 masks are coming back into Home Depots and different places. people should really seek their medical advisors, because you got to remember, people that wear N95 masks, you need to be cleared to wear it, because it could affect you if you have certain medical conditions. So I just want to make sure people understand that. Danielle, did you want to speak to that about the two masks? Anybody else want to talk about the two mask question?
I say Dr. Daniel.
I'm sorry, Dr. Danielle.
I think I think the same. It really just depends on what mask you have. So I think people who are doubling it up are thinking it's offering better protection. So I've never seen anybody put two N95s on top of N95. So I think that they're usually like a cloth mask and then the surgical mask or something like the blue one that a lot of people wear, or they make them in black now because I guess it's sleeker that way. But I think for the most part, it's someone feeling like they don't have enough protection from their mask, and if they feel like that and they can breathe through it and they're wearing it appropriately, with it fastened to the nose bridge and underneath the chin, and it's a seal, then it's good. But if wearing two masks is allowing one to slip and or it's giving you a headache or ear pain or things like that, then it's not useful.
Also take into consideration with those N95 masks, you have to be fitted for those. Everyone's face is not the same. So the N95 that I wear may not fit someone else's face on here. So you're not getting the best out of that N95. You're not getting the protection that you think that you're getting from that N95 if you're not properly fitted. There are multiple different types of them, and they fit different people's faces just depending on your facial structure. So always keep that in mind too, that, you know, to get the best wear out of an N95, you need to be properly fitted for one.
I think Teresa had something she wanted.
Just basic mask. People, you are not protecting yourself when you wear a mask. You are protecting others around you. You are blocking your droplets, which is why your nose needs to be covered, because droplets also come out of our nose, micro droplets. So unless you are wearing an N95 mask, you are not protecting yourself. So the whole two mask thing is, you know, to me, it's like first they were saying don't do it. You're not letting off enough of your carbon dioxide. Now they're saying do it. So I'm kind of like on the fence. When I have been in the grocery store, because I go to work, the grocery store, and home. When I go to work, I wear a KN95 because I work 12 to 16-hour shifts. And if you have never been fitted for an N95 and you've never tried to work in it, it is very, very difficult. It is, it's hard. It's hard. It's hard to have this thing sealed on your face because there is a complete seal because you've been fitted for the mask. Simple mask, surgical mask, you're basically, if everyone has on a surgical mask, nobody's spewing droplets where someone can get the virus. You're not actually protecting yourself. So people need to understand how the mask works. With the N95 mask that you are fitted for, you are in fact being protected from what is in the air. It is what we use for when people have tuberculosis. KN95 is more filtration, and it's more protection than a simple mask. And to me, if you have that option and you can get a hold of one and you're going to be in public places like the grocery store, yeah, it would be good. I've given all my kids one that I've ordered, online. But the simple mask, you're basically protecting your community or whoever you're standing next to, or just lowering the droplets that are being, put out into the atmosphere. So people need to actually understand what the mask is doing.
You know, it's very important. And that information is definitely so helpful. Me having a mechanical background, there's a lot of research going on about our ventilation systems in hospitals. It's kind of my area of expertise. I know a lot of people is trying to figure out why was it that when people were traveling on airplanes, people wasn't catching COVID. And a lot of it was because air in, air out. And that's how we're trying to build our facilities to bring in 100% outside air and circulate the air that way. So that's one way that we're trying to help uh, do that to stop the spread of the virus. But again, in larger institutions, you can afford it. You start getting to these smaller commercial buildings and things of that nature. That's where the resources can impact, the people in the healthway when they don't have the upgrade funding to make those type of changes. So I think that's good information. I think one of the other questions we had coming in here, it was, how can one notice any adverse reactions so quickly if trials usually 5 to 10 years? And why is this being rushed on people, particularly people of color? And is it a simple immunity boost? Why not other methods? Anybody want to talk to that? I guess they're trying to find out if why are they pushing a vaccination if the trial is supposed to take 5 to 10 years, and the immunity boost. If you guys looking at chat, it's in there as well.
Well, what I've read is that from all the other vaccines, a majority of the serious side effects they say happen within 2 months, within the first couple months. So that's how they were able to get the vaccine approved under the Emergency Act. Now, what they found from other vaccines as well, like the long-term effects of vaccines, they haven't been really scientifically been able to correlate some health condition to someone actually receiving some vaccine 10, 20 years ago. So there hasn't been any in other vaccine trials ever proven that a cause and effect. So that's why they're also able to put it out with so quickly. And then it was made so quickly because they already had the framework built, because there have been other mRNA vaccines before, and all they had to do was get the code for the spike protein for the current, whatever current strains were around at the time for coronavirus. It's being rushed because a lot of people are dying, especially people of color. And like I said before, we haven't been able to fix this with masks, hand sanitizer, and distancing. So this is the next step. The other method would be just to catch it yourself and get your own immunity if you really want to do that and not expose anyone safely. But you can catch it and get your own immunity. But if you're around people, you have family, I work, I can't be away from work that long. I have like, if you have reasons why you can't catch it and be out of commission for 2 weeks, then the vaccine is a good second option. And it, like I said before, produces a more robust response that is proven to protect you better for future infections of COVID.
Cool. I think that was very good point on that. We are definitely starting to go into the second hour of the show. We're going to the 3 o'clock hour. I know we've been heavy on the COVID. I want to kind of shift the conversation because I'm seeing the people out there. We get the gloom and doom. We want to kind of now shift the conversation for our Black and brown communities on other health issues. And this is where I want to kind of hold in on you guys, kind of professional backgrounds. And let's also try to start talking about some of the other health issues that's impacting the Black and brown community that you guys are seeing in your different areas, some of the inequities. We have a lot of issues when it comes to healthcare. We posted a bunch of videos in our group. I know John Hopkins and another couple of institutions have been talking about the racial issues when it comes to healthcare. Sometimes how the healthcare provider or the healthcare system has been detrimental to the Black and brown communities. And then as we spin out of this COVID question, and I know you guys kind of touched on it, but we just really still need to hone in. Why is it that when these type of issues in the healthcare comes, the Black and brown community is always hit so heavy? And I know resources is one of it. Is it just the stigma of, or because of the past of the medical but it seems to be that the Black and brown community is always hit the hardest when it comes to healthcare. And I just want to kind of get you guys perspective on it. And it's no right or wrong answers, just I'm trying to help community because everybody's saying, why is it that anytime something happens, we are always affected? And I understand the financial end. You know, when you have the financial resources, you have to navigate systems a little differently than people who don't. But I mean, that's one part of it. But I mean, really, is it systemic institutional health racism? Or is it just the stigma and the taboo of Blacks and browns saying, hey, we don't trust healthcare?
I feel like it's both. Uh, uh, Black and brown communities have had to rely on themselves for everything. So, the mistrust of the medical community is valid. It's a valid thing. If you have money, you get better care. It's an unfortunate reality. Um, and so the mistrust, I think for me, I look forward to the future, right? So we continue to have conversations with our youth, with ourselves, with our families. It starts at home, educating ourselves and people, anybody that you touch, about things you should do. That's too much salt. Stop sprinkling that salt. That's too much fat in your diet. That's too much starch. You're going to get diabetes. Like, we have to govern ourselves and police ourselves. And seeing African American doctors, nurses, healthcare workers, um, anybody that's involved in the health thing, seeing our faces. So that's going to take to continue to foster this in our communities, foster it in our children. You can do this. You can be a part of the health solution. We can see, they need to see more African American healthcare workers. They need to see it. And so we have to be it, we have to foster it and support it. Like, financially, mentally, we have to support it so that they will continue to carry the torch, that we'll see our representation and become more comfortable as time goes on. But it's a real thing. It's definitely a real thing.
I'm glad you brought that point up. I think that's very powerful. And me and Rico, we've been really hounding in. We had our educators come on, and we understand we're getting a little bit more clear of some of these inequities through the educational process. And I think that is very important, that we need to see not only in our education system, but in the healthcare system as well, people who look like us, who understand where we're coming from, understand some of our background. And the thing is, how do we get there with so many educational gaps to get people in the educational system and in our community to make the education and medical field cool. So I think that's why it's just powerful that you sisters are here today to represent that, because we need to see it and we need our young people. And there's a lot of young people who want to do this, but have the school systems been set up so much to deter our young people from getting in it. And I would like to see the UC system, Stanford, do a better job in recruitment and helping our young people at a younger age to get them in the medical industry. And I know there's a lot of talks and things that's happening about inclusion and diversity in all these institutions. And I think it's time for action. We need to see it and get our young people involved so the next generation of young medical professionals could be seen in these industries. So thank you for bringing that up. That's very important. Dr. Danielle, did you want to say anything to that?
Yeah, that question is complicated as far as there's so many health disparities and healthcare disparities. So there's health disparities and healthcare disparities. So the things that are system-wide disparities, and then the things just that affect one community more than the other. So I work primarily with African American population and the Latino population. That's what I've always set out to do. Is where my training is all the studies I did when I was in medical school at UCSF. I would work at all of the county hospitals, at the General. I would work at Highland. When I did my residency, I was in LA at a county hospital as well. So I've seen a lot of disparities, and there's a typical overarching issue, one of poverty. And because of that, if you start off that way, you are already on a bad foot. And then having insurance is not like a human right. So not everybody has insurance. So if somebody has some problem and they never can address it because they don't have insurance, it just festers. Or if someone doesn't have even like a family structure that educates them on how to eat or what to eat, or maybe you don't even have access to, maybe your only store that you can eat is the local corner store. So there's so many things that just set up, food deserts, like where there aren't any Safeways or Whole Foods or Trader Joe's or Sprouts in a however mile radius of African American and Latino communities. So even if it's trying to eat healthy, well, they have to drive 30 miles, they don't have a car. Or so it's like so many things set up against African American community. And let's just say that they did have access, but let's say like nutrition is just a big thing. Changing nutritional habits, especially when they're cultural, is a huge undertaking. So that takes a lot of time and trust and understanding, and a provider that will actually spend time with you and try to explain to you why cooking your chicken in a tub of butter is not a good idea to do every day of the week. So it maybe sometimes, so it's not even really sometimes, but it's a large conversation of really actually understanding like what people do on their daily, because I think a lot of times, at least my patients like to tell me what they think I want to hear. But I actually want to know what is actually happening, so I can help correct that. Now, every provider is different, and that's also the struggle in medicine, is that it's just it's trial and error about the physician that you get or the practitioner that you get, that you connect with, that understands you culturally. So all these things have to come into play to improve someone's health, unless they just know how to research it on their own, which also comes to access. So it all kind of comes all around to the same things about money and just having that access, and then being treated, let's say you do have money, being treated correctly in the system and being given the same care of another counterpart of a different ethnicity. So it's racism, I think, and financial status.
Yeah, I think that's huge. The level of care is definitely a point that we definitely in the future have to hone in on, because this Western medicine is seeming to bite us in the rear end. I mean, I just see it. People going to different things, and I mean, even just going to a doctor's appointment at Kaiser right now in this COVID, it's just amazing how doctors they don't check, right? They just want to prescribe a prescription and say, hey, try this. If this don't work, we'll try and prescribe you with this. And it's frustrating because I've had seniors and relatives that I've sent, and it's like, well, what did they do? And it's just like, oh, they said, try this prescription. And then, if this doesn't work, come back, we'll try this. And I think we got to get out of that. But I think you hit on something key, nutrition. We had Chef Mimi on one of our hidden gems, and she talked about the importance of eating and this food issue that's really impacting our community. And like Teresa said earlier, community, we got to hold ourselves accountable too. We got McDonald's and every fast food on every corner, and we need to hold our cities and counties accountable, especially when it comes to these liquor stores, and make sure that we get the right health food in our community, and then get the right educators to help educate the people on how to cook these healthy foods. And then we have to make it, like you said, in a way that's affordable, because Whole Foods and Trader Joe's for people that have 5 or 6 kids is not financially going to be the best option for them. And I think we definitely have to hone in on that. We've been reaching out. We have an educational Thursday segment. We've been reaching out to nutritionists out there, and this is a good leeway for some of the people out there to join our platform. If you're a nutritionist out there, we need this education for our community. Come on and teach a class on making sure that our people understand how to eat right. So with that being said, I'll move over to Naisha. Did you have something that you wanted to put on for the?
Yeah. First of all, with us in the Black community, we're already predisposed to certain things. We're predisposed to diabetes. We're predisposed to hypertension, cardiac disease, all these things that already run in our family. So we already have these predisposed diseases. So, as Dr. Danielle said, and Teresa said, we have to take ownership for that. We have to be responsible for what we eat, what we do, staying active, all those types of things. In my experience with working with a lot of our population, we are non-compliant. We are non-compliant. We live in a state of denial as well. When the doctor is saying, hey, you are, your blood sugar is going up, or, your blood pressure is going up. You need to do this, you need to do that to lower it. Before we have to go to those medications, we live in a state of denial, and we are non-compliant to what our doctors are telling us to do. And then we get to a place of, okay, now we're in a danger zone now where we have to give medication. We have to do more drastic things just to bring these blood sugars down, bring the blood pressure down, and we're still non-compliant. We still want to eat the fried chicken. We still want to eat the salty foods. We still want to do all these things and live in a state of denial. So that is my experience with a lot of our population. A lot of our people is that we're not taking responsibility. We're already predisposed to these things. Then when we had these early signs that these things are coming, they are in our family, we are having signs and symptoms of it, and we're still not doing the things that are necessary. And now with COVID, we have even more barriers of trying to get healthcare. Now we're doing this telehealth thing now where we're not even, in physical proximity of our doctors. And so our blood pressures, our vital signs are not being taken like they would be in the clinic. Now we're just seeing people via phone. And so now we're definitely not getting the care that we need. We're definitely not getting those blood tests and those things to make sure that we are doing the right things. And so because our doctors are not seeing us face to face, they are just prescribing this and take that and do this, and these things are not working. And so now we're not really accessible to our doctors, because now with this telehealth thing, we have to wait weeks and weeks and sometimes months to even get another appointment. So with this whole COVID thing and this telehealth, these are even more barriers now that our African American and Brown people are struggling with healthcare.
Yeah, that's deep. And I think some of the messaging that went out originally when it came to COVID kind of, I think, threw the community off, because I know people who was going to take their tests, and a lot of the information that was coming from the facilities was, it's nothing we could do. All you have to do is just go home and rest, drink water, take a nap. There's nothing we could do. So when you tell people that, it's just like, well, might as well go outside because they can't do nothing for me. So I think the way it was messaged a little bit going out was a little challenging for some of the people in the community. And I think that's why people still was kind of like, well, if you catch it, you can't do nothing anyway. They're just going to tell you to go home and sleep and drink water and treat it like the flu. And I think that was one of the curves that kind of took us, into that lane of people being a little defiant. But I definitely think that our people have to do a better job of listening and being mindful of what the physicians are leading them to. Danielle, I see your hands up. You had a question?
Yeah, I was thinking as Naisha was talking, I kind of feel like it's a catch-22 with our doctors. We almost treat them like we do our police. We go to them when there's problems and issues, but because there has been an abuse of power, we don't always know to trust them. My mother just recently had some heart issues. She called her doctor, and they just sent her all this medicine, like for blood thinners and everything, this huge bag. And she's like, I don't want to take this. They haven't run any tests yet. I mean, I've had other friends who, had great health care, but went in there and healthy, but just had some natural issues, and just was receiving the worst treatment. So it's hard for us. I feel like we've been faced with this discrimination. So it's like we want to trust them, but can we really trust them? It's difficult. So I feel like it's kind of like a catch-22. So I feel everybody on us keeping our bodies healthy, but oftentimes there has been a lot of us that have gone in the hospital for one thing and just never made it out. And we're not always treated with the same care. So that's unfortunate, but that's something to think about too.
So, real quick, Rico, did you want to say something? But real quick, the effect of the technology and some of the things that you guys are seeing, right? Because I know it was mentioned that, with the parents being not able to go into the hospital, how bad has the technology in this pandemic affected us? And how do we get out of it? And I also want to lead with Danielle's question is how, and I know the way we're doing this now, but how can we get that relationship better? Bridging that gap between the healthcare and community.
Can you repeat that question again, John?
I was saying, how do we repair the communication between the healthcare and community? Since it has been tarnished, and you said, like, it's kind of like the police. Danielle was saying, how do we build that? I mean, I know you guys coming here today is one way, but we really have to deal with this, because if not, it's going to kill us on the back end. And I think Teresa said it early. We have to hold ourselves as community accountable. Same thing with the police. All we do is want to blame the police. But then when it's time for the police to get involved, nobody wants to help them. And it's the same thing in healthcare. We come when there's problems, but then we don't want to do what the healthcare providers are telling us that we need to do. How do we fix this? How do we get this? Is it more smaller hubs of communication? I don't know, but I just want to kind of hear from you guys' perspective. And then how has the technology, with this telecommunication, with healthcare, or just being in the ICU or being in the hospital with this technology in this pandemic, how has it really impacted us? Or what have you guys seen, how it's been a struggle for physicians or people to do their job with the technology struggles? That's kind of like where I was trying to go with that.
Okay, I can answer that question. As what Danielle had said, my daughter was having, some cardiac issues for a couple of years. And the same thing, when she was younger, we'd take her to the pediatrician. It was like, do this, do that. And we did all those things, and none of those things worked. And after, not just being satisfied with the result that I was getting, I did end up having to change physicians. And that's one thing, you have to do some research on your physician. Sometimes, just asking people and inquiring people, like, who do you see and how do you feel about your physician, and so forth and so forth. And that's how we get, just by word of mouth, is how we find a lot of information from our population, is just word of mouth. So I finally found a Black physician for my daughter. And she finally did the things that were necessary. Instead of just telling her to do this or do that, she did the testing that needed to be done and sent her off to a specialist. But it took years in finding the right doctor to actually get what we needed for my daughter. So to build that trust with that physician, it's, first of all, it's word of mouth. Like, who do you see? Who's your doctor? How do you feel about your doctor? And looking at the health of that person. So that's how we found the doctor that we have for myself and for my daughter, is just word of mouth, researching that doctor, having one of those introductory type of visits, get an objective of your doctor and see if you guys can see what type of relationship or rapport that you guys have with each other, and developing a plan of care and going along with that plan of care, and being and approving that plan of care. You can approve that plan of care, or you can make adjustments, or you can, have some compromise with your doctor. Your doctor can meet you halfway. So finding doctors like that. As far as the barriers go with this COVID thing, the telehealth barriers, one of the things that we have problems with is canceled appointments. A lot of appointments are being canceled now because of COVID. when doctors used to see, 30, 40 patients a day in the clinic has been cut in half now. So now the doctors are only seeing 15, 20 patients in the clinic and doing everything else via telehealth. And then those who rely on public transportation, our transportation has been, slightly, changed. We have cutbacks in that. So we don't have those options for transportation. Other things with telehealth, how much of our Wi-Fi services are working. So now that we have children in our houses using up the Wi-Fi, the communication back and forth between our doctors can be a little choppy. So we're kind of hearing every other word when we're having a telehealth appointment with our doctors. And our doctors are only on a limited amount of time. So, because now they can't see people in the clinic, they have more telehealth patients or conferences or appointments that they have to do. So, those are being cut in half. And then what about the people with disabilities? People who have language barriers or other type of disabilities. That telehealth is also it causes a barrier, not being able to see your doctor face to face. So I feel like with our pregnancy population, a lot of tests are being missed. There's certain tests that have to be done in certain stages of your pregnancy that you have to go to the lab or you have to be seen at your doctor's. And so because the doctors are only allowed to see so many people in the clinic because we don't want to overpopulate our waiting area, those tests are being delayed or they're being done too late. And then when those tests are done too late and you have gestational diabetes or gestational hypertension, now we're kind of late on treating that, and so that jeopardizes the pregnancy. We have people that have come into labor and delivery and like, oh, their group B beta strep hasn't been done, and that's a test that's done at 36 weeks of pregnancy. And so we're having to do that test while they're in labor, but that result doesn't come back for 24 to 48 hours. And these are things that should be done prior to them going into labor. So those are a lot of the barriers that we're seeing. A lot of patients having different issues with their pregnancies that they can't see the doctors for, so they are coming into the hospital. And so things that you should be able to go to the clinic for, now they're impacting, the hospitals and getting treated for that. And now they're, kind of putting themselves at risk coming to the hospital because they can't get some things done in the clinic or because the appointments are not available.
Wow, that's good information. That's definitely information we need to hear. Dr. Danielle, since you on the streets, on the ground, what are some of the challenges that you see in your practice? Just doing the work you're doing, because I think you have a good perspective of just seeing, because definitely when you're dealing with the homeless population, communication is hard and technology is hard. So how has it been for you guys doing your work in the community in those areas?
So I think that working at a community health clinic, and specifically the one I work for, which is a nonprofit, and it's not a federally qualified health center, which is subject to other rules and regulations that we don't have, I actually have a lot of flexibility. So she was saying 40 people having to see them before, 40, 50. Like I've always only had maybe like 20 or so. And now it's less. So working at bigger institutions like the Kaisers and the Sutters, the doctors do have a large patient load because majority of the time those patients are generally healthy, so they're supposed to be able to get through the visit in 15 minutes. That's literally what they allot for us, 15 minutes. And in that 15 minutes, I'm supposed to listen to you. I'm supposed to understand what you need. I'm supposed to get you what you need. I'm supposed to get to your note. I'm supposed to put all these things in all in 15 minutes. Do an exam. This is before COVID. So now it takes a little longer because we can't move as quickly, because if I need to do an exam, I have to kind of explain to you now, can you open your mouth or can you do this? It takes longer than if I was in the room, I'd just be able to do it very quickly. So those facilities, the bigger ones, are impacted. Like I can see my patients my patients can make an appointment every few days if they want it. So by mostly by phone, and also, but because it's not safe to have so many people come in the clinic. It's not because we don't want to see them. It's because if they come in the clinic and you have all these people in the clinic, we likely give someone COVID, which is opposite of what we want to do right now. So getting out of this pandemic is going to be great for everyone overall, for various reasons. But as far as it affects us in scheduling and seeing patients, it's definitely affected because of the virus, not because we don't want to see the patients. But I work at a small clinic, so my office like has, give you a picture. One office has 4 exam rooms, and the other office has 7. So think about when you go to Kaiser or Southern, it's rooms upon rooms upon rooms upon rooms. That is how their system works, and it works by the number of people that they have in their health plan. So my clinic, we primarily see Medi-Cal patients, and like 90% Medi-Cal patients. So Medi-Cal is through the government, so they can see me without a copay often as possible, as often as they need. So that's the patients that come into the clinic. Um, um, but I do have a lot of homeless patients that aren't necessarily at an encampment at a spot. So I do see them like throughout the week, even if I'm not directly going to their encampment. My job has not actually changed any different. I still go out. Actually, it added another day. So I used to go out 2 half days a week to the encampments. Now I go out 3 half days a week to the encampments. And that part has not changed. Only thing that changed was my like the approach. So before, the approach was really tackling primary care issues or whatever urgent care complaint they might have had at the time. Now it's primarily focused on testing, rapid testing, and then if I can address other primary care issues, I do that as well. So I'm fortunate in that way that I work somewhere where I can be flexible, and that is why I chose to work here versus somewhere else, because this place is like a unicorn. It's not typical in the medical field. You usually have very strict, like, you have to see this number of patients in a day. You have to do this. You have to write these many notes. You have to do this. It's so many things that they put on us in the back end, as physicians and as providers, that really take away from the direct patient care. So I chose to work here for that reason, so that I can give the patient the time that they actually need and deserve. So my answer to your question is that if someone doesn't is non-compliant, it might be the provider-patient relationship that is the issue, and that person should know that they're not married to that provider. That just because their insurance assigned them to this person, they can easily choose someone else. They can easily choose a different plan. Let me take the word easily out. They can choose another plan. They can choose another provider, which would take some research on their part. They might happen to stumble upon someone that will give them the time and care that they need, but they also likely might not. Unfortunately, all providers are not created equal, and we all are different, and we all have different styles. We all have different communication. We all have different backgrounds. So finding someone that you think that you can trust, I think it really comes down to a trust level. And you don't really know until you have that first visit with them. Give them a chance, talk to them, see if they listen to your needs, and then take it from there. But also, you have to understand what we are taught in medicine. We only know pills. So if you want to know about how to use turmeric and elderberry and all the other things that are great, CMOS, all that stuff, that depends on that provider's personal views, actually, or whatever additional maybe training, holistic training or alternative medicine training that they took. That is not a blanket education in our curriculum at all. Somebody had to have sought that out extra. So if you want that, if that's what you want, you don't like pills, then don't see a doctor that has no training in alternative medicine, because you're gonna get advice on pills, because that's how we treat things. It's very strange. Like, I know very limited information on nutrition. My nutrition classes were very minimal in medical school and in residency. I had to seek it out extra, and it still wasn't enough to actually tackle the vast amount of nutritional questions I get. So I always need to refer to a dietitian or nutritionist, which are actually lacking and very hard to get my patients to. So it really comes down to that provider's knowledge, like how that person feels about them, and you can shop around. You're not married to this one provider.
That's pretty powerful, good information. And I know definitely, even for my granddaughter, it's a challenge to get like a Kaiser to pick good doctors. And it typically seems to happen when you do find somebody that's black or brown who are good. They like they overbooked. So it's like, hopefully that these people that's watching and listening that has the influence in these medical facilities can really think about it, be a little bit more intentional with the data and the community that they serve, and to get more people who look like us, because it's a big challenge. I know a lot of the hospitals, you can go online and pick your doctors, and it's like all of the good doctors is for whatever reason you could be like, boom, can't take any more patients. So definitely that's something we got to work on. But I want to jump over to Teresa real quick, and then Danielle had a question. But I know, Teresa, you're an important part of the hospital ICU with the peds, but just from an ICU standpoint, I know a lot of surgeries because of COVID has been on hold. I have relatives who still waiting on surgeries. I know the ICU is always happening. What are some of the challenges that you're seeing in the ICU room when it comes to the COVID technology, communication, working with the patients and families and stuff? Because I know it's a lot of challenges in that area as well.
There is. It's a changing environment in the ICU. The whole hospital has no visitors. Adults have no visitors, and what they're saying about people dying with their nurse by their side is absolutely true. They may make exceptions and let a spouse in, but I'm not hearing that that's the case. Pediatrics is totally different. Like, in order to separate a child from a parent, it's detrimental in some cases, right? You have kids that are, so attached that you're not gonna be able to even care for them. So when the pandemic first started, we had one parent at the bedside. They had to choose which parent it was. There were no swapping out. There were no in and outs, like Naisha said. You came, you stayed until you were discharged. Then it kind of got a little lull in the Christmas time, or maybe before Christmas time, and then we went back to having two parents. So now keep in mind, these children are in ICU, which means they are critically ill. And it's so hard for us because the parents are our best friend as a nurse, because that parent can tell me he grunts when he's in pain. He won't say owie. He will stop drinking. This is what he does. This is what he doesn't do. They know their child best. So they are our right hand in treating and caring for a child. I'm thinking of a particular parent and the exhaustion that I see in her eyes from being the only one there. The husband has to be on the phone, like we'll call for any updates. But just the fact that she's stuck there with her child. I mean, I don't want to say stuck, but she's stuck there with her child for days on end with no relief, right? So it's very difficult. It's very emotional for us nurses. We feel bad. On the other hand, we don't want all these people coming in and out of our unit. We want to protect ourselves and we want to protect the other children from COVID. so so you have that, right? So you want to limit your exposure. I mean, that's not an easy thing to do, but it has made things very, very difficult. The other thought that I thought about was that unfortunately, some people are going to be at home suffering with illnesses and ailments because they are afraid to come to the hospital, because they're like, I'm going to go in there for this knee pain that is killing me, but I don't want to get COVID. So they are going to, you're going to also have another disparity, and which is sad. So, or they'll wait to the very last minute, because the thought of me going is to sit in the ER. Like, I have to be close to dying before I would probably go to an ER and sit for however long it takes them to see me, because of the fear of COVID. So now you have people with things that have nothing to do with COVID who are at home trying to suffer or handle what they're going through themselves when they probably should be seen by a doctor. And that's very difficult right now, to think about. But it's been a challenge. Technology wise, it's not so much of an issue in the hospital. There's Wi-Fi in the hospital and things like that. But as far as the being separated, not being able to visit, not being able to leave out, it's a hard thing. Fortunately, the children, as you guys have heard, have not been coming in very ill with the COVID, but they are positive. These little critters are running around with virus and it hasn't stopped them, right? So those little kids could be positive for COVID, but it's grandma that they'll take down and they'll be just fine. So yeah, it's we do have kids that have been positive on the regular pediatric ward, but then and again, we not sick enough to be into my ICU. So thankfully, the children are faring better. I don't know what it is about their little systems that are not taking them down like us adults. It's probably that they don't have all the pre-existing conditions that adults have. They don't have diabetes and hypertension and heart problems and things like that. So it's just not taking them down like it's doing the adults. But yeah, I haven't had it hasn't been as bad for my particular unit with the children and being hospitalized. As far as the surgeries, yeah, they slowed down and they picked up a little bit. There's some surgeries that just can't wait. Brain surgery can't wait till COVID is over, because who knows, cancer surgery can't wait until COVID is over. So they basically, heart repairs can't wait. Probably electives. Yeah, there's been a big decrease in electives. But most of the time with kids, it's not a lot of electives. There's more like they need this. So it's happening. And yes, sometimes we've had full unit full of surgical children. The good thing is that they're strong. They're so strong. Children are so strong and they heal much faster than adults. And so you can get them in there, get the surgery, and get them out of the hospital and back home as soon as possible is basically the goal for the unit as a whole, and the surgeons, the doctors, and things like that. So it's, everybody's impacted in a certain kind of way, but you're just doing the best that you can for the times that we're going through.
Wow, amazing. And there you have it, people. We got to keep our healthcare professionals in your prayers for you guys that's doing the healthcare work. Humanity, compassion, and be patient because some of these people are not having their families around. And I know that's also a scary thing. You come in here, especially our elders in the community that's going into hospitals. No one could be there to advocate for them. So definitely just want to make sure that our healthcare providers that are working with these people continue to have the compassion and patience. Sometimes it's scary for our elders when they don't see nobody they know around and you have to help them and it might get a little tense. But we got to keep that level of professionalism and compassion for our seniors and our young people. So thank you guys. Danielle, you had a question you wanted to throw out there?
Yeah, I want to thank everyone again, our nurses and doctors that are out there on the front lines. Thank you for all this important information. I had a question about what you see in 2021 because we know because of the quarantine, a lot of mamas got pregnant being in the house all day and everything. So I know people now that are pregnant that will have their babies this year. So I know there will be an increase in pregnant women in those hospitals for 2021. And also patients that needed surgeries their surgeries were backdated and placed back. I know some people too that are overdue for surgery. And so they need to get up in there, but because due to the pandemic and so many people positive with the virus, they've not been able to get the care they need. So do you see this thing getting kind of worse as far as patients in the hospital for 2021? What are your thoughts on that?
I can answer that. We do have, we kind of look at the projection for the next few months as far as deliveries, and there will be a big baby boom for pregnancies and deliveries. We're expecting high numbers of deliveries March, April, and May, and also our summertime is always has always been a high census for deliveries. What's sad about that is that when a woman goes into labor, she has a group of women. It's very cultural for most cultures, has a group of close women that are there with her through her labor process to help support her. People that have been, probably her mom, grandma, aunt, cousins, that have been very close with her through her growing up life, that are now not being able to be there to help support her through that labor process. And so, we're finding that, the mothers having to pick either the father of the baby or their mom or somebody that's a woman that is close to them. So of course, naturally, that woman's going to pick the father of the baby because, he does have a right to be there, especially if they are in, a relationship. So what we have seen now, which is kind of like creative but crazy at the same time, is a lot of births are being FaceTime. We have, these moms come in with their phones, and they have their grandma and their mom, they're FaceTiming as they're going through this labor process. And it's really, really sad because we're used to, I remember having my 3 kids and, my desire to have a natural birth, and I couldn't get through, the labor processes that I had without my mom and my grandma, my aunts being there. So them not being there has been a huge detriment to the labor and delivery patients population. And so now we have this big boom of projected deliveries that are coming. So now we have incorporated that now our patients can not only bring in, a support person, but they can also bring in a doula that has been prearranged in the clinic, a few weeks in advance before delivery, because we see that that is an important factor for our patients, especially our patients that are trying to go natural, unmedicated, less interventions, that they need this labor support. They need someone other than their significant other to help with that labor process. So those are things that we have incorporated and then we have also kind of helped in change, and also kind of creating more staff so that, we can also kind of help. We can't always be in the rooms with the moms because, the risk of exposure and all those things. But those are one of the things that we have incorporated was allowing a doula, especially with our young mothers. We have mothers that are, teenagers, late teenagers, 18, 19, 20, 21, who don't have their mommies there. If my daughter's 20, and I would be devastated if I couldn't be there, to support her through a labor process, because she had to pick and choose between me and the father of the baby. So now that this doula doesn't have to be, somebody who's trained or anything, but, another woman or support person that patient chooses as a labor support to help them get through that. So it's kind of another kind of backdoor for another family member to come in and help with that process, just to make things a little bit more smoother. As far as delay with our procedures, because there is such a delay when this COVID thing does kind of resolve, our outpatient surgery centers again are going to be impacted. My daughter has, as I said before, has a cardiac issue that needs a surgical procedure. However, because at this time it is not life-threatening, it has been postponed, hopefully to the summer. But if it gets to be a life-threatening situation, then yes, they will act upon it. But it's like we have to get to a life-threatening situation before it gets acted upon. And that's kind of a detriment to us, because now we know that we have a condition, but because of COVID and it's not life-threatening at this moment, we're not going to do anything about it. But if it gets life-threatening, why do we have to wait till it gets life-threatening before you do something about it? We kind of want to get ahead of things before some catastrophe happens. That's what we used to do. But now with COVID, we have to wait for a catastrophe to happen before we act on it, because right now it's not emergent. So those are the things that our patients are kind of facing, those ones that need procedures. They're not emergent, they're not urgent, they are needed, but we're kind of postponing it. But also there could be a ticking time bomb if it's not acted on or corrected immediately. So those are some things that we're facing.
Wow, great information. Rico, you wanted to say something real quick?
Yeah, we kind of moved kind of fast, and I had a question and a burning desire a while back, but I do need to say it, and I guess I'll form it as a question, because I do hear a lot of the disparities, but then I do hear that there is a lot of information out there. So how do we bridge the gap of the disparities in our communities if we're not creating pipelines to bridge the gap of the disparities, right? So even when we could talk about education, we know the disparities, but there's no true pipelines to get our African American and kids of color into colleges and getting them exposed at an early age to know, okay, I want to be a doctor, I want to be a lawyer, I want to be this, I want to be that at a very early age, and then exposing them to it, right? So we don't have that accessibility in our communities. So like, as it relates to the healthcare industry, how do we start bridging those gaps and creating pipelines to get our families more involved in healthcare? I think that information is 100% key. That's why we have both sides of the conversation. But then also information can be toxic, right? Because I educate folks on food all the time, and like no matter what, they still say grandmama down in the South lived to be 100 and something, and she ate all the bad stuff possible, right? So they don't believe what what we're saying to be factual and to be true, right? So like, how do we start to bridge that gap and create some pipelines and infrastructure so that we are educating families and we are creating systems where it is more people that look like us? Because I think as a culture, we're comfortable with people who understand us, and a lot of times when we do go to the doctor and we do go places, the people don't look like us. It's very uncomfortable. Um, they don't get it, and then sometimes they say stuff that be they're trying to crack a joke, but it's so offensive that it's like, well, I don't even want to go back there no more. So like, how do we create those pipelines? I guess that's what I'm just trying to ask, is like, how do we create infrastructure and pipelines, even in each of your fields, to get younger people involved, but to wanting to be a part of this field, but then also families, and how do we get them educated on wanting to be healthy and live right?
I think probably as far as the education part, I'm thinking when I think about the kids, like targeting junior high kids maybe, because so that they'll start thinking like maybe even as a freshman and a sophomore, like, do I think I might want to, maybe exposing them. The old bring your kids to work day. I don't know if, some of that would be influence the kids. It's hard, we have to reach out to kids that are in our circle. If you are fortunate enough to have pulled yourself up by your bootstraps and got yourself some education, it is our duty to share with whoever will listen. This is how I did it. And sometimes just being vulnerable. I was scared. I had no idea how I was going to pay for the school, but I did it. You can definitely go to a junior college, and that's the more cheaper way to get to your goal. I guess you just have to talk and try to make alliances and bridges. And when your friends, your kids bring their friends over, have random conversations like, oh, y'all want something to eat? Okay, come on in here. Let's talk about this and talk about that. My kids, they get so aggravated with me because, anything I see and I think my kids need to know this, I'll bring it up. If I see something in the hospital, if you see a teenager who has, sniffed some paint, I'm on the family text, like, listen, this is what he did. This is what he tried. This is his outcome. He's in my ICU. This kid tried this synthetic marijuana and he is neurologically devastated. I know they get tired of hearing from me, but it's my job. It's my job as a mother to pass on the information. Whether they take it in or not is up to them, but they will never say, my mom didn't tell me. My mom didn't say that. She didn't share that. She kept this information to herself. Do they want to hear it? Yeah, they don't act like they do. Do they even respond? No, sometimes they don't. But I believe that kids do listen and they do reflect back, and they may not ever tell you, Mom, I thought about what you said, such and such. And it's really hard because the teenage years, the kids are that was the worst time in my life. I will be honest, was when I was raising teenagers. Literally, it was, I didn't think they were going to make it out alive or myself, because I just thought, I'm just going to drive myself off the bridge because nobody's listening. Nobody's doing anything. Everybody's misbehaving. Like, it was just difficult, but somehow they all survived, and so did I. And, I went to college with 3 young children, and I would tell them, yes, I'm doing this. This is what I'm doing. This is the hard way. But yes, it can be done. And yes, you can go back if you don't listen to me and get the college done at an early age. It's never too late. But I'm doing this the hard way. When they see me in there with the book crying because I'm like, how do I read 67 pages in one night? And it's 11 p.m. at night and I'm exhausted because I've worked. I talk a lot. I talk a lot to my kids about everything and anything that crosses my path that I think they'll be wiser to know, because me dying with the information means nothing. It's hard though, but I think talking to junior high kids, thinking back on my kids and their development, because some of those seeds have to be planted earlier. And I would say even earlier than that, to plant the seeds. You don't want to get too much into it because they'll pull back, it'll be overwhelming. But you start talking about it in elementary and junior high, and you see that and see how he's doing, and telling our kids, oh, there's different ways to get that nice car. You can go to college and get a good job and still drive that nice car without doing anything illegal, and we try, and you just have to keep trying. You keep just pounding on their little heads as much as you can. use every opportunity to have these conversations and try to impart the knowledge and just pray that it sticks, something sticks with someone. You know, if you help one kid change their life, you've done a lot, you know, because if we all help one kid, where would we be, right? You know, and it may not even be your kid, because sometimes you can't get your kids to listen to you, and you need to take them around other people that they may listen to, you know, and that's just a fact. That's just a fact of raising kids. It's one of the most difficult things you'll do in your life. And reach out and keep our community open. And they're on Facebook. You know, we have all this technology, all this social media. Do what we can to get information out and talk to whoever will listen.
Wow, that's good information. Very powerful. That's one thing we keep preaching over here to our young people. You don't know who listening. Just keep talking. Somebody might get it, but we got to lead by examples. And that sounds like what you're doing here. And Rico always preached this. It takes a village to make it all work. So definitely when you have opportunity with our young people, they might not listen to me, but they might listen to Rico, or they might not listen to me, but they might listen to you. So we got to keep spreading the information. Very, very important. With that being said, we are getting close to closing out. We got a few minutes left. So what I want to do is, did anybody want to answer that question, or are we going to move into closing it out?
I had just a little bit to answer that question when you talked about how do we get our youth involved. Career fairs. I've been a part before COVID. I've been a part of a lot of career fairs. So if you get people that are in certain different professions, you know, that are able to talk about their profession, what they do, how they went to school, how long schooling took, all those, you know, frequently asked questions about that profession. That is one thing that'll get our kids interested and involved and stay involved and interested in trying to get into these type of professions. You know, there is that saying, birds of a feather flock together. So, you know, our youth getting around people that are mentors in these type of professions, in nursing, in doctors, you know, getting around those type of people and seeing what they do. Before COVID, you know, you were able to shadow a doctor, shadow a nurse, shadow people in certain different professions, and being able to see what they do on a day-to-day practice. As far as our health fairs, you know, we've had blood pressure health fairs, we've had finger stick blood sugar health fairs, we have informative health fairs, giving information about our predisposed diseases like cardiac diseases, hypertension, diabetes, all those things, ways of preventing, you know, doing little fun little tricks, or not tricks, but games and things to kind of educate people on what these diseases are, their disease processes, and how to prevent those things. So these are ways to keep our community involved, giving information to our community, help keep our kids involved as far as career path and journey and what to choose as far as what they want to be and how to be successful in going into those type of careers.
Dr. Danielle, did you want to say anything on that question about how do we get the young people involved?
I would just echo all of those things. My clinic, we do a really good job at having a lot of social programs. If you look on our website, it'll list. There's so many things that we do to reach out to the community. And then we have, like, we used to have the big things before COVID, where we had these like health back to school fairs at least once a year, and other ones. But honestly, it also just happens through the visits, I think. Like my personal interaction with mothers, because I'm family medicine, so I see from newborns all the way to elderly. So, and I even see pregnant women as well. So, I think if you have a good relationship with your medical provider, that's also a starting point as well.
Okay, definitely. That's cool. So as we close this out, I just want to come back around to everybody to get them an opportunity to close out some last statements to community. We still have a lot of people watching. I think this is a good opportunity for you guys from a professional standpoint to help start bridging that gap with giving some people some good advice on why to take this health thing so important and get seen and all of that. And just some closing out words for the day for our community. But I'll start with Danielle and we'll just work our way through everybody.
Yes, thanks again for everyone coming on, giving us information. What I'm taking away today is know the facts, seek information where you can. As Nisha said, if one healthcare professional isn't giving you the information you need, seek another one, seek alternative, advice. It's okay to get more than one advice. It's okay to ask questions. I do want to go back and say something too, because we talked about vaccines in the beginning of the conversation. Health and politics can be intermingled, and unfortunately, you cannot sue a vaccination company if you are injured from a vaccine. You can sue a pharmaceutical company if you have a drug injury or you are faced with some reaction for that's severe, but you cannot actually sue a vaccination company, but you can seek compensation. So for those that want to know more information with that, go online and type that information in. There are vaccine attorneys that can give you the law, and so your rights concerning about that. But with that said, I'm just glad again everyone's here, and we definitely need to have this talk again.
Thank you. Thank you. Naisha, you want to go ahead and give us some closing words to the community?
Sure. First of all, I want to say thank you again for having me. I just want to let the community know that these are very, very tough, unprecedented times that we're going through right now, but tough times do not last. Tough people do. I would ask the community to do everything that they can to help limit the spread of COVID so that we can get through this together. Advocate for your health, do your research. You're responsible for your health. We're not responsible. You're responsible for taking charge of your own health and the decisions that you make for your body. So do the work, do the research. Everything is not going to be handed out to you. Ask the right questions. And like I said before, if you're not getting the answers that you are seeking out, you're not getting respected, you're not getting the things that you need from your provider, get another provider. Word of mouth, when we talk about restaurants, this restaurant's good, eat here. This restaurant's terrible, don't eat here. That's how we get word of mouth about different businesses. Get word of mouth about your doctor. How is this doctor treating you? Is this a good doctor for you or for me to see? Get those type of information and ask the right questions. And again, if you're not getting what you're looking for, always get another opinion.
Thank you. Thank you. Great information. Ms. Teresa, you want to go ahead and give community some last say off words?
I think I talked enough. Everybody just be safe. Do the best that you can to keep yourself safe. And think about your other family members that you are in contact with that you love so dearly, because there are some people that are doing the best that they can to stay safe and they still may become ill. And I ask for all good thoughts and prayers for my granddaughter that will be born in April of this year with her grandma doula by her side. And I ask for all prayers and thoughts for a healthy baby and an easy, smooth delivery. And to all mothers that are delivering, try to keep yourself safe and put your baby first and yourself first, because it's important. It's important.
Thank you for those kind words. And we definitely gonna keep you in your prayers. Dr. Danielle, you want to say any going away words?
Sure. I just want to say thanks for extending the invite. I am happy to talk to people about anything related to health. I'm always the one that, like, of my friends, you can call or text me anytime. We can chat about health, and I'm the same with my patients. Maybe they can't call or text me, but they can make an appointment and we can talk about it as much as possible. So for those who do not have health insurance, I really, really urge those to get it if at all possible. If you don't make a lot of money, that means you most likely qualify for Medi-Cal, which is free. For those who get insurance from, let's say, our employer, we always have to pay a little bit to go see the doctor. You have to pay a little bit more to see a specialist, things like that. So, and even if you're in that ball game, it's still important to at least check in with your primary care physician. I would say at least once a year. Even if you feel completely healthy, fine, just check in at least once a year. And if you're not healthy or fine and you got questions, ask them. If you're in the bigger systems, you probably have a way that you can directly message your provider. There's no limit on how much you can contact them. So just contact them, ask them your questions. Don't feel that you can't. And if for some reason that provider you have an issue with, then get another one, and then until you have a good doctor-patient or practitioner-patient relationship. And lastly, we are not out of the storm yet. It is still going. I know it's been getting close to a year, so we all kind of feel we can feel really lax and might want to start going out and doing things or letting up our guard. But we're not out of it just yet. So keep doing what you have been doing to keep yourself protected this entire time. We're still in it.
Oh, wow. Thank you. Powerful words. Rico, you want to go ahead and give yours?
Of course, of course. I just want to thank everybody for coming on. Another amazing show, another amazing individuals that's doing amazing work in the community, making sure that they're educating the community and doing all that they can to support and uplift the community. Hopefully, we can have you guys back on another show. I know I have 1,000 ideas right now going through my mind about what we can do and what else we can add on to this conversation outside of COVID-19. But like, how else do we continue this conversation to keep the community engaged and keep individuals thinking about health and being well overall? You know, because I love wellness, and I think that everything kind of tie into each other as one. So thank you, ladies, again for coming on. Me and John and the team will be at you. I know that Naisha, she know we're gonna be bugging and doing all that we can to bring you back on so we can continue on these conversations. Thank you so much.
Man, I just want to say thank you guys as well. It's very important in community. You know, definitely keep our healthcare professionals in your prayers. Do all we can to bridge this gap to show them that we acknowledge them, and they are very important for our day-to-day needs, especially these sisters here. I know I do my part. You know, once a week I try to at our cafeteria at UCSF buy a nurse a lunch, buy a doctor a lunch just to show appreciation. I think we should, when we see these professionals, instead of getting mad because they walking in the grocery store with their nursing outfit on, let's salute them and support them. I think this conversation was very powerful and impactful to the community. I seen the comments and the interaction. We're going to continue these health conversations because we need to have it. We have to break the stigma and this taboo in our community about healthcare and about health physicians. We had a couple of people here today that took the vaccination, and you guys see that they here, because I know sometimes in our community we have to see it to believe it. So you see it, they still walking around, they still doing the things that they need to do. So we have to get out there and support each other. Let's get out there and get vaccinated. Let's get out of this thing so that we can definitely be more intentional in the future of protecting ourselves. One good thing about this COVID-19 is have made community and everyone more aware and conscious about how we clean, how we dispose disease, and how we look at dealing with each other in interaction. And I think that's very important to get out of this. But definitely there's going to be a continued influx of information that's still going to be needed to the community as we move forward. And we're going to do our part here at both sides of the conversation and continue to educate our community. We're going to get our educational Thursday slots filled. We're going to get some more of these people that's in these professions of nutrition and different things, and even our holistic forms to start teaching community about these different natural remedies and things of that nature. So keep looking out for it. Keep tuning in. We're going to keep this conversation going. Like I said, today, this was part one of it. We're going to have part two where we're going to be focusing in on Black male health next Sunday. Very important conversation from our Black Panther Party. I think that conversation is going to be definitely a huge, because we understand that male health in the Black and brown community is impacted dramatically when it comes to getting checked for colon cancer, pancreatic cancers, and different cancers and things of that nature. I think they're going to have a great conversation on that. And I'm just looking forward. And as we move along, again, this Tuesday, we'll be jumping into our hidden gem segment here at both sides of the conversation. Y'all know every Tuesday what it's all about. It's about educating the community about who our community activists are, and we're promoting our Black and brown businesses. So definitely this Tuesday at 7 p.m., reach out to us. You guys can see the episode, how we impact our community by promoting our Black and brown businesses so that we can patronize them so they can be effective, especially in these COVID times. We need to make sure that we are patronizing our Black and brown businesses, and we will continue to highlight individuals in our community that are doing amazing things like these ladies here that's really impacting us. And then this Thursday, we'll be jumping into another educational Thursday. We'll have another amazing presentation for you guys. We have a wonderful sister that's going to come on and teach a great class that I think is going to be very important. The information will be coming out this week for community. So just thank you guys again for watching. Please support us. Go to www.bothsidesofconversation.org. That's where you can find all of our upcoming shows, topics, things that we're going to do. We want to get you involved. This platform is for community. We definitely want our professional feedback from people that's any professional for these topics, but we also want to hear from community because we know you guys have the questions and then you guys are the ones that's being impacted. So we're going to keep this thing going. Thank you all again. Be safe out there. This COVID is real. And as Dr. Danielle said, we are not out of the woodworks yet, but we are marching to it. The better that we follow the rules, the better we get out there. So with that being said, all love and peace. We will see you guys next Sunday.